new study just caught my eye. Improving end-of-life care with AI. Now, when I hear AI and end-of-life care in the same sentence, I immediately think of some little chat GPT powered robot wheeling into a patient's room to tell them that they're dying. Awkward. But let's take a closer look at how the researchers actually used AI in their study, because it's pretty cool. Researchers developed a system that used AI to identify hospitalized patients who were at high risk of dying while they were in the hospital. So the algorithm would flag these patients and then send an alert to the attending physician. That doc would have some options: have a goals of care conversation with the patient themselves, refer to palliative care, or disagree. So what happened? Well, first, let me tell you what I love about this study. It systematizes something that has been desperately needed: checkpoints that are built into the healthcare system to pause and talk to patients about what matters most to them. Instead of relying on individual doctors to decide who needs a conversation or when they need the conversation, the AI piece of this removes that guesswork, removes the subjectivity. But what good is flagging a patient for a goals of care conversation if the doctors aren't trained in how to have a goals of care conversation? What good are more palliative care referrals if there's not enough palliative care staff to go around? Well, this study included training the clinicians on how to have a proper goals of care conversation, and it made sure that the palliative team had the capacity to receive more referrals. Palliative care experts were involved in this study, and it shows. Okay, so you want to know what were the results? Goals of care discussions in the hospital increased by 5-fold. Palliative care referrals went up by 63%. What? This proves that when you build these conversations into the workflow with the proper support, doctors will have them. Imagine that. And this is exactly how cultural shifts happen in medicine. Not by asking individuals to change their behavior, but by hijacking our default pathways on a systems level and creating routine opportunities to have the conversations that matter most. So, is AI going to replace palliative care? Absolutely not. But this study shows perfect synergy between palliative care and AI. AI can flag the patients who could most benefit from a conversation, and the conversation itself is left in the hands of trained professionals. I am so thrilled to see movement towards systematizing palliative care involvement for the patients who need it most. And in the meantime, if you are dealing with a serious illness and you feel like you could benefit from a conversation about what matters most to you, ask for that palliative care consult.